everyone to the webinar today that's titled Promising or Participatory Practice and Health Promotion in Canada. We're really, really happy that you can join us. We need to let you know this webinar is being recorded, and we're glad to see that. So here is us. I'm Diane, and in the background you have Danielle, and we're really, really thankful for all of her help in helping us pull this together. As many of you know, we are one of 6 national collaborating centers in Canada. If you'd like to know more about the other NCCs, it's best probably to visit the website at NCCDH.ca. And we are NCC for Determinants of Health, and we're located in beautiful Nation, Nova Scotia, and we're on the campus of St. FX University. And I see Ian has dialed in from the Yukon government. Hi, Ian. Nice to see you. I think we met a few months ago, so really, really glad you can join us. And I want to begin by most importantly acknowledging that we are hosted, as I said, by St. FX. The important thing to know is that we are in Mikmaq, which is the ancestral and unceded territory of the Mikmaq people. You know, we acknowledge this land not only in thanks to the Indigenous communities who have held a relationship with this land for generations, also in recognition of the historical and ongoing legacy of colonialism. One of the really wonderful things that's happened here in this past year is that St. FX now flies the Mikmaq Nation flag alongside the university flag, the Nova Scotia Canadian flags, and it was a really wonderful development, and we're very, very proud and very thankful to be here. And Lorraine, that's wonderful of you to acknowledge that you're in Treaty 6 territory. If anyone else feels they can share and would share where they are related to the First Nations territories, that's a really wonderful way to honor the land that you sit on. This is a little bit about National Collaborating Center for Determinants of Health. Many of you are familiar with us and our work. Our website is nccdh.ca, and we have lots of new resources and more information there for you to find out more. So this is a quick polling question, and I'm just going to find it here, or maybe Danielle can actually pull it in for us. We're wondering where everybody is and where you are calling in from. So I see Danielle is just there. She's just cleared it. So we're going to ask you to do a quick vote of where you're calling in from. And I think, based on what I've seen in the chat box, we have every province plus the Yukon. But we really like to get a sense of where everybody is calling in from here. I see someone has clicked U.S., which is awesome. Let me know in the chat box there where in the U.S. you're calling in from. But also, if I see someone, I think 2 people have actually dialed in calling in from international. So I'd really love if you can indicate for us in the chat box exactly where you're dialing in from. We've had some neat international participants before. I've had people call in from Portugal during webinars I've done, England. I think once there was someone from France. So it's just always really neat to see what reach we have. And I do see, yes, we've closed the poll. I saw that Nunavut and Northwest weren't indicated, but I know someone's on the line that does a lot of work in Nunavut, and we'll take that information back. This is a link to our evaluation slide, survey, sorry. If anyone has to leave early, please fill out the evaluation for us. A good thing to do would be to link on this link now, pull it up in your computer, and then quickly fill it out. It will take less than 3 minutes to do, and we really do use the information to help us plan future webinars, and we've included a question on other things that you want to know about this topic that we could cover in future webinars, and so we will go back to that to help us plan over the next year or so. So yes, thank you in advance for doing that. And hi, Stephanie from Southern Health, and Shauna from Ottawa, who have acknowledged the territories where they are in the chat box. So we have 3 other speakers today. You won't have to hear much from me. We have Dr. Jeff Masuda, who is an associate professor at Queen's. We have Dr. James Springett, who is a professor at the University of Alberta. And we have Wendy Pederson, who coordinates the Downtown Eastside SRO Collaborative in Vancouver. We will do proper introductions for these speakers when we get to their pieces of the webinar, but right now I want to thank them, acknowledge that they are here and acknowledge their contribution, and really, really appreciating their partnership over the past few weeks and couple of months to pull this together. And with that, I am going to turn it over to one other speaker. We have been developing these webinars in cooperation with Health Promotion Canada, and this is definitely a partnership with them in developing this as part of an entire series. So with that, I'm going to turn it over to Irv and Leslie to say a bit about Health Promotion Canada.
Yeah, thanks, Diane. I'm assuming everyone can hear me.
Yes, great.
So I'm just going to do a brief introduction to Health Promotion Canada, then turn it over to Irv to talk a little bit about these webinars specifically. So Health Promotion Canada, hopefully everyone has been to the website and has seen that there's lots of opportunities to get engaged and involved. And I'm just going to highlight a few things that we've got going on, and then I'm going to pass it over to Irv. You'll see Jose is on this slide of Health Promotion Canada volunteers because she's been instrumental in helping us with these webinars on the French side. So any of our friends that are working in French, based in Quebec, I'd really encourage you to connect with Jose. She's at the University of Montreal as a PhD student. So these are examples of some of the volunteers that are involved in Health Promotion Canada. So just quickly, the mission of Health Promotion Canada is to advance the practice of health promotion in Canada, and it's around engaging all of the different players and partners. That includes students and researchers and practitioners and employers. Of course, public health is well represented in this community because public health has such a focus on health promotion, but it's a group that also includes people who are doing health promotion, engaged in health promotion across various sectors. So we really are focused on being a volunteer-based interdisciplinary group, and we've only really been in existence barely 2 years, and so if you have an interest in helping, I'd really encourage you to get in touch with us and become a member. The way that we're structured is we have an executive committee of volunteers that meet monthly to keep the work moving along. We have working groups that focus on various aspects of things that we're trying to achieve, whether it's advocacy or working on the core competencies or accreditation or recognition of health promotion practice in Canada with our annual recognition awards. And so working groups and committees are groups of volunteers that advance those. We'd be really excited to have you involved in that if you have time. There are provincial networks, and so some people who are engaged at their local level are really involved in developing local initiatives. So I'd encourage you to get in touch with your local chapter or network, which you can find the email addresses on the Health Promotion Canada website. So the website does have a bunch of resources. It has a newsletter that you can sign up for, even if you're not a member. There's the Competencies Toolkit, which is available to you, the Core Competencies for Health Promotion. So I'd encourage you to go and check that out. But just to make a note that if you are a member, so if you sign up and purchase a membership with Health Promotion Canada, you get access to a bunch of support resources around the core competencies, as well as you get access to the member contact list. So there are some specific advantages to joining Health Promotion Canada, so I'd really encourage you to do that. And just a reminder that the core competencies for health promotion are really focused on health promotion. They are across 9 domains, have 34 statements, and we're always looking to find out from people how they're using these competencies. So again, I'd encourage you to go and check that out, and if you want to get involved, please be in touch with us. So a couple of things that we have going on right now is we are doing a survey with health promoters in Canada around core competencies, accreditation, and quality. So hopefully you will be connected into that network distribution at some point. We also have an awards program that has just been launched, seeking to recognize people who work in the field, students who are engaged in the field, organizations who've done excellent work around health promotion. So if you want to nominate anyone or any organization, please go to the website and download the forms. We'd love to find out about new programs and people that are doing health promotion in Canada that we can recognize. And of course, we have a webinar series, which is what you're participating in at this exact moment. And this webinar series is based on the newest edition of Health Promotion in Canada. So that gives me an opportunity to turn this over to Irv Rootman, who many of you know as a founding father of health promotion in Canada, who's been active in editing and coordinating the development of this particular resource, and he's got a couple of things to comment on the Health Promotion in Canada and the webinar series. So Irv, I'm going to pass it over to you.
Thanks, Leslie. I'm more of a grandfather than a father, but I'll accept father because it makes me seem younger than I am. So anyways, the idea for this webinar series came from the Health Promotion Canada professional working group that I co-chair with James Springett, who happens to be one of the presenters today. We approached the National Collaborating Center, Determinants of Health, with the suggestion of doing a series based on the recently released fourth edition of Health Promotion in Canada, which has 15 new chapters and a new afterword written by Ron Labonte, as well as an instructor's manual. We also, for this edition, added a new editor, namely Kate Froelich, who replaced Michelle O'Neill, who was one of the editors of the first three editions. In any case, we were delighted that the National Collaborating Center agreed to sponsor a series of 5 webinars based on 4 of the chapters in the book, listed on the next slide. So the first one on contrasting entry points for intervention was held in English in June and in French in July. As was the case with the 2 webinars to date, the webinar today and the webinar next month will feature authors of the chapter as well as a health promotion practitioner to comment on their experience of how the chapter translates into their practice. There are a number of other chapters that may be interesting in terms of future webinars as well. These are just 3 of them. In closing, I'd like to thank the sponsors for their contributions to this webinar and the other webinars based on the 4th edition of Health Promotion in Canada, as well as thanking all of you for attending this webinar. As Leslie indicated, I would encourage you to attend the webinar next month and consider becoming a member of Health Promotion Canada, as well as nominate a person, organization, or team for an award through our awards program for this year that was launched a couple of weeks ago. So that's it for me, and we can get on with the show.
Okay, thank you, Irv. That's great. We're really happy that this partnership has worked out, and we've had lots of interest from our audience, and